Dr. Beng Eu here. I'm here to talk about things that you might not have asked your doctor about. First thing I want to mention is about the prostate. So what's the prostate? So I've got an old-fashioned picture here that shows that, so that's the prostate there, and that's the penis, and that's your bladder. So it's a little gland that sits between the penis and your bladder that causes all the secretions that help your ejaculation and things like that. So it's a good thing to have. However, sometimes it might need treatment. So when you're younger, the only things that happen to the prostate is that they might get infected or they might get inflamed and cause a bit of irritation, that's all. But as you get older, they get a bit larger normally, and that's quite common. And sometimes you'll get prostate cancers that might need treatment as well. So I'm just here to talk a bit about those things. So as you get older, if your prostate enlarges, you might have trouble peeing, or you might be waking up a lot at night to pee. And if that's the case, you should go to your local doctor and have a talk about that, because there are treatments available, and some supplements can help with that, or if not, there are some medications that can help with that. But you need to be tested to make sure it's not anything more serious than that, though. And if there are any problems, you get referred on to a urologist. All right. But the thing we worry about obviously is prostate cancer. So as men get older, there is a risk of prostate cancer. If you have a strong family history, like if someone in your family has prostate cancer, or if your family in general has a history of cancers that could be hereditary, then you should probably have some monitoring of this. Prostate cancer monitoring usually means it's a blood test, a PSA test, which is not a very accurate test, so it's just a rough measure. And also often just a finger examination to see if there are any lumps or anything on the prostate. So a lot of men don't like having this done because it's an anal examination of the prostate gland from behind. It's a bit uncomfortable, but it's worth doing because detection of prostate cancer is really important if it's early on. Because if you can pick up prostate cancer really early and get referred on to a specialist, then you can talk about options. And sometimes some prostate cancers don't need treatment. Sometimes they just need to be monitored, and the urologist will just monitor it if they think it's a slow-growing prostate cancer. But some of them are more aggressive and needs more active treatment. So the earlier you find out, the better. So I think sometimes we tend not to get help because we don't want to hear the bad news. I think sometimes it's better to find out all these things earlier, because the earlier you know, the more options you have in terms of treatment, and generally it's better outcomes. And I think it's important to be involved with our own healthcare and make those decisions. And this is one of those areas like prostate cancer and treatments, where a lot of urologists now will involve you in their decisions. They'll give you the options and you can talk about which way you want to go with it. There's not necessarily one treatment that suits everyone, and obviously, certain treatments have got certain risks, so you need to think about that. For example, having surgery might affect your erections and things like that, so you might consider that. But I suppose I just encourage everyone to just get tested and to talk about treatment options early, because the earlier you know, the better options you have. If you find out much later on, you're pretty much locked into more serious treatments later on. All right, so I think that applies for general health as well. I think you shouldn't be ashamed to talk to your doctor about if you think you've got prostate issues, if you're concerned about erection problems or anything. You should always just go to your doctor to talk about it. If you can't find a doctor that's suitable, you might want to find a different doctor to talk about things that you don't necessarily feel comfortable talking to your regular family doctor. I know, for example, that some guys don't like to talk to female doctors about sex or prostate, and sometimes it's the reverse. They don't want to talk to male doctors about that either. So whatever suits you, as long as you get some healthcare and advice and you're in control of your own health and decisions. All right, till next time, bye.